What common infection can turn a friendly lick into a life-threatening emergency? And why does one tiny bite still cause tens of thousands of deaths every year? Stay with me. We'll answer that and show what actually saves lives. Welcome back to ZooScope. Today we're unpacking rabies, an ancient viral disease that affects mammals worldwide, the science behind how it works, how animals behave when infected, and the steps that really prevent deaths. Don't forget to like and subscribe. Let's get into it. Rabies is a viral infection caused by lyssavirus family viruses that attacks the nervous system. It is present on every continent except Antarctica and causes acute brain inflammation that is almost always fatal once clinical symptoms develop. Globally, an estimated around 59,000 human deaths occur each year from rabies, mostly in low and middle-income countries where access to vaccines and treatment is limited. Rabies is transmitted through infected saliva, most commonly by bites from rabid animals. Scratches or contact of saliva with mucous membranes like eyes and mouth can also transmit the virus. In many parts of the world, domestic dogs are the main source of human rabies deaths, while in other regions, wildlife like bats, foxes, raccoons, and skunks are important reservoirs. Breaking the chain of transmission means focusing both on animal vaccination and immediate human care after exposure. After an exposure, the rabies virus travels from the wound along peripheral nerves toward the central nervous system. The incubation period is variable, typically 2 to 3 months, but it can range from a week to a year or more, depending on factors like bite site, virus dose, and host factors. Early signs may be non-specific, like fever, headache, local tingling, or burning at the wound. Once the virus reaches the brain and clinical signs appear, the disease progresses rapidly to encephalitis and death in most cases. There are two classic clinical pictures in people and animals: the furious form with agitation and aggression, and the dumb form with weakness and paralysis. In animals, you'll often see dramatic changes in behavior. Early signs include unusual friendliness, or conversely, sudden shyness, changes in vocalization, drooling or difficulty swallowing, staggered walking, paralysis, or aggressive biting. Wild animals may act tame or oddly bold. Domestic animals may show excessive salivation, restlessness, or progressive paralysis. Because behavior varies and can look like other illnesses, animals suspected of rabies are tested by examining brain tissue using the direct fluorescent antibody or DFA test or other validated laboratory methods. Never assume an animal is just ill. Treat exposures seriously. If this is helpful, hit that like and subscribe button. Immediate action saves lives. Wash the wound thoroughly and vigorously with soap and running water for at least 15 minutes. This simple step significantly reduces viral load. After washing, seek medical care right away. Medical evaluation determines whether post-exposure prophylaxis (PEP) is needed. PEP generally includes rabies vaccine doses and, for severe exposures, rabies immunoglobulin ARG infiltrated around the wound when available. These measures prevent the virus from establishing infection if given promptly. Rabies is effectively preventable with correct and timely PEP. The most powerful public health tool is mass vaccination of dogs. World Health Organization and public health experience show that vaccinating about 70% of dogs in a community can stop transmission and eliminate dog-mediated human rabies. In many countries, integrated programs, dog vaccination, plus community education and accessible PEP-P have driven human rabies deaths towards zero. For wildlife reservoirs, oral bait vaccines have been used successfully in some regions to reduce rabies in foxes or raccoons. Tackling rabies means combining animal vaccination, surveillance, and human access to care. Now, let's see what to do and do not in case of being bit by animal. Do: wash any bite or lick on broken skin immediately with soap and water. Seek medical care for PEP assessment. Vaccinate your pets and keep their vaccinations current. Report strange animal behavior to local animal health or public health authorities. Don't try to handle or capture wild animals. Assume a small wound is safe. Delay seeking healthcare because of cost or travel time. Delays can be fatal. If you live or travel where rabies is present, consider pre-exposure vaccination if you'll have prolonged animal contact or limited access to care. Rabies is tragic because it is preventable. The path to ending dog-mediated human rabies is known. Sustained dog vaccination campaigns, accessible and affordable PEP, public education about wound washing and animal behavior, and lab capacity to confirm cases. Many countries and projects have shown rapid declines in human cases when these measures are put in place. International partnerships and local community engagement are what finally turn prevention into reality. Rabies is both ancient and preventable. Immediate wound washing, quick medical care, and vaccinating dogs are simple, proven steps that save lives. If this helped you, share the video to spread the message. And if you have a question about rabies in your area, ask your local health or veterinary authority. Don't forget to like and subscribe. Stay curious, and bye-bye.